Everyone, it's me again, nurse practitioner Dr. Katina Kennedy, here with some health information for you. I received a lot of inboxes. Please talk about PCOS, polycystic ovarian syndrome. Very, very common, unfortunately. Polycystic ovarian syndrome is basically a hormonal disorder that causes enlarged ovaries and small cysts, polycystic ovarian syndrome. So a lot of small cysts covers the ovaries, and that interferes with ovulation. And the hormonal changes that can occur is there is a high testosterone level. Now, testosterone levels, that's mainly a male hormone, but of course female have testosterone as well, but it should not be high in the female body. So the high testosterone levels causes the irregular periods, excess facial hair. All right, it can be on the chin, on the chest, also on the side of the face as well. So you have the excess facial hair, acne, obesity, irregular periods. So all of this is caused, all of these are signs and symptoms of PCOS, polycystic ovarian syndrome. So the main culprit is that high testosterone level. So when you go and get your blood checked, your gynecologist will order a test, your hormones, and we usually order testosterone, hemoglobin A1C. We usually order thyroid testing, your TSH, T3, T4. We also order LH, FSH. Again, those are some things that you wouldn't know about, but those are some hormonal tests that we as healthcare providers will order to diagnose you with PCOS. Okay, so the question is, I have PCOS, what can I do about it? Polycystic ovarian syndrome. With this syndrome, you all don't have regular periods, or you may have a period every 3 months or every 6 months. So to help regulate your periods, we put you on birth control pills. Or for those who don't want to go on birth control pills, some gynecologists will start patients on Provera, maybe like once every 3 months, to help shed the endometrium. So again, birth control pills to help regulate the period, and so that you'll have a period once a month. Metformin. Metformin is a medication known to be given to diabetics, but the research does show that it has some effects on decreasing the cysts on the ovaries. So metformin will be given. And then also in PCOS, we may see an increase in blood sugar. So metformin actually helps in that way as well. Cholesterol medication may be given because unfortunately with the high testosterone levels, with the obesity, the cholesterol is elevated. And then also ultimately, what can really help you is weight loss. I know you always hear it. I know it's hard. But if you lose the weight, you get at a healthy weight, those cysts will decrease. I have a lot of my patients, once they lose at least 30 pounds, their periods start to get regular. They now can conceive because they've lost that weight. So weight loss is important. Exercise to lose that weight. And then ultimately eating healthy. I know you always hear that, but that's important. What we ingest in our body really, really affects us. So that's the gist on PCOS. The information I mentioned here is not limited to this information. There's a lot of information on PCOS out there, but I just wanted to give you the main points of PCOS and some things that you can do to help regulate your periods, or the things that we help to manage PCOS. Because unfortunately, you can't get rid of it, but you can manage it. But I've seen where, like I said, when you lose that weight, guess what? You're fine. You're great. You're back in action. Have a nice day.